Hey, good afternoon, Santa Clarita. This is Tom Burton, the Orthopedic Program Manager from Providence Holy Cross Medical Center, bringing you the Providence Holy Cross Health Hour. Just enjoyed the drive coming up. Very short drive. For those of you who ever actually had to come down to the hospital, realize that without traffic, it's about 8 minutes if you hit the lights right. And we did, by all means. We were up here very, very quickly. And just truly enjoying the day-to-day. Another stunner out there, with baseball in full force. All the high schools are out playing. Because our proximity next to Alamany High School, our parking area, we get the chance to watch all the baseball that's going on every time we leave. And just something about that fresh smell of mown lawn. Way too good. You're probably going to wonder, and I know I talk about this each time, why Holy Cross here in the Santa Clarita Valley? And unbeknownst to most, that we have been providing care to not only the north end of the San Fernando Valley, but also Santa Clarita Valley since the 1960s. And as the valleys have grown, as so have we. We're now at 377 beds. We are still a not-for-profit hospital, which we're extremely pleased with, allowing us to bring the best care to anyone who needs us, which has been great. We're a level 2 trauma center. Oftentimes you see those helicopters flying from Santa Clarita and swinging right into the valley to land over at Holy Cross. And not only that, but as a member of Providence, we're part of the third largest not-for-profit health system in the nation. Now, with size, the concern comes, are we going to lose that one-on-one care, that patient experience? And the answer, well, frankly, it's no. We rank top 5% nationally for quality. As an employee, we're one of the top 150 places to work in the nation in healthcare. And what I'm really, really jazzed about is recently we were taking a look at our patient surveys, and our patient experience surveys were having us at 81 to 90%, rating it as a 9 or a 10. And in the hospital world, that is huge news. And at sometimes we're actually rated higher than all the other Providence hospitals within the system. So cannot be any more pleased about that. And most of us call it home, too. More than 20 to 30% of our employees live out here in Santa Clarita, enjoy living out here in Santa Clarita. And I would probably say about 30% of our patients now are actually driving down and allowing us to be an integral part of their care. So we just want to thank you very much for, again, accepting us. And, if you keep blinking your eyes, you're going to see Holy Cross cropping up into Santa Clarita. We realize that being able to deliver the care and be the ones who are delivering the best care, we need to be closer. And so we feel that Santa Clarita is a very large population that is utilizing our services. And you're going to find Holy Cross cropping up all over Santa Clarita in a variety of different ways. And one specifically is the Holy Cross Plaza over at the corner of Valencia and McBean, which is going to be housing one of our new stars. And I'm going to be so happy to be able to introduce this. I have to break my notes out. Make sure I get this right, because as for those of you who actually are listening to the show or listening to the podcast, realize that I do get a little smile on my face and a twinkle in my eye when I get to bring up those 4 little letters, UCLA, and that makes me extremely happy. As one of our new stars coming in with the Providence Medical Institute, we'll just kind of talk about this gentleman. We'll give you the name last, see if maybe you can guess. Board-certified gastroenterologist and internal medicine. Now, he is a Midwest guy and did a lot of his studying over at University of Chicago, and then went a little bit across town over to Rush for his medical school. He decided to go east, big mistake, to go to the hospital University of Pennsylvania, where he did his internships and residency, and then finally wised up and came over to Harbor, yes, say it with me, and we can do an A-clap, UCLA. We are so pleased that he actually joined in with the Providence Medical Institute back September of last year in 2016. And I'd like to introduce Dr. Rahul Chhablani.
Thank you very much for those kind words, and I'm grateful to be here.
And glad to have you here too. Now, one of the first things we always want to be able to find out is it's an interesting direction that you went. What brought you to gastroenterology?
People ask me that question, and the honest answer is I enjoyed plumbing, and I liked working with my hands, and look, someone's got to do it, and I'm glad it's me because I love what I do, and coming to work every day is a pleasure. So that's the bottom line why.
That is about as accurate as you can go. I was going with spelunking, but yeah, you went with plumbing. Now, I did have the opportunity to take a look at the at health grades and vitals, and your approach to patient care. You want to maybe talk about that a little bit before we get into the nuts and bolts of why we're really here?
Right. I mean, I think my philosophy, if patients come to see me, is you're coming in with a problem. Let's give you the personal attention you need, and you have my ears, and what I would recommend to you is what I would recommend to any family member that would come to see me with the same problem. So, we're not out here to do procedures if it's not necessary. We don't want to subject you to unnecessary procedures or even imaging studies if it's not recommended. So let's make it personalized. Let's see what you have and what you've been through, and is there something different that needs to be done in order to get you better?
That it's, I'm glad, and you said it extremely well, and a number of our physicians who've been on the show as well have basically emulated the same message. And I think it probably stands to the ideas that at the hospital itself, that it's not the physician, it's not a physical therapist, it's not a nurse. Everyone is referred to as a caregiver, and as we hear, the concept of being treated as if they were family, as if that's how we would want our family treated, seems to be a common thread, regardless of who we talk to. And so it makes me smile just to be able to hear that again. When in general, the medical field hasn't always been as warm and fuzzy, type of a thing. But we're really seeing a shift or a change.
I think so. People are dealing with real problems, and if we can personalize it and dehumanize a disease process, I think it's easier to manage, and also not only the physical aspect of it, but also the emotional and psychological impact that these common diseases have on people, and not to forget their families.
Right.
So it's important to do that.
The emotional intelligence, and for those who have had to experience being involved in with physicians or because of medical complications or however, will recognize that for some reason nowadays, more so than ever, the emotional intelligence of all of the people who are involved in patients' care has become so great. And as you said, it's you're not just taking care of a problem; you're taking care of a person, you're taking care of their family, and it makes me feel really good to hear that. And hopefully, everyone in Santa Clarita who's having the opportunity to be able to listen today here on KHTS, who has been, by the way, a huge backer for Providence Holy Cross Medical Center. They support us in a number of different ways, and including giving us the opportunity to be able to come to everyone here. So we really do appreciate that. And if you are listening, you're probably either on the radio or you can actually get it on the KHTS app. You can go ahead and put it on your Android or iPhone. Downloads very easily, works great, and you can actually pick up the show anywhere in the world, which is great. So we want to make sure that we do that. Now, as we're as we move along, everyone, from last month, we kind of led in about a week previous to the Cancer Awareness Resource Fair, which I understand was it's the first annual, and it was a huge success. And it kind of allows us to kind of easily roll right into one of the big reasons why you're here, not only just because of who you are and what you do, but we are literally at March. All right, March 2017. March is Colorectal Cancer Awareness Month, and that really is that's the topic of today. And I'll just go over a couple of stats I found.
Sure.
And you had stats that you found that you have as well. And definitely correct me if mine are a little outdated. But third most common cancer in the world. Okay. In 2012, 1.4 million new cases were diagnosed worldwide, which is an astronomical number. Approximately 135,000 new cases were diagnosed in the United States in 2016. 49,000 deaths, which is an enormous number of deaths due to colorectal cancer during the same year of 2016. Though, and we'll kind of go into this a little bit more, as especially how we do our testing and everything. Most cases are diagnosed after the age of 50. Though, as we were talking beforehand, that's even changing. And the trend, though we can see a trend that the number of cases being diagnosed is starting to decrease, you're actually noticing a shift in the population and the age groups being diagnosed.
Correct. The statistics that you mentioned are real. They're staggering. But I'm encouraged that not only are we getting better at screening and detecting colon cancer at an early stage, but as you had mentioned, the younger population, we're seeing for some unclear reason an increased incidence of colorectal cancer, especially rectal cancer in younger populations. So, the one message I want to give out is, if you are younger, having any GI issues, consider seeking consultation with your primary care physician and then to a gastroenterologist for evaluation, because you don't want to minimize anything that's happening, but you certainly deserve a careful and a thorough evaluation, especially if you're having, blood in your stools or any unexplained abdominal pain, weight loss, and especially if you also have a family history of colon cancer. Those are things to make sure that you do put on your radar, talk to your doctor, and then get referred to a gastroenterologist.
Right. And then, so the common risk factors, what should we really keep an eye out for?
If there was just one risk factor out there, then we would just be talking about that. But, sometimes, we worry about obesity being a risk factor, tobacco use being a risk factor. And now, just recently, there's an article from the CDC and World Health Organization talking about increased consumption of processed meats being a possible risk factor. But, we just have to look at, we're talking about, you're not a statistic when you come to see your gastroenterologist. You're a person. So we look at your history, your family history in particular, look for any concerning signs or symptoms that you may have, and then recommend testing accordingly. So, there are symptoms out there, but colon cancer does not have one specific blood test that we look for. Sometimes it can go undetected unless it becomes a problem, and at that point it does become late stage. So, keep in mind what your family history is, and if you otherwise have no family history, once you turn 50, and if you're a white male or woman, you need to consider getting a colonoscopy. If you're African American at the age of 45, the recommendation is to start at an earlier age because African Americans tend to have a higher incidence of colon cancer. So shifting the screening age from 50 to 45, we're able to detect a lot more polyps or cancers earlier to minimize their risk of progression to incurable disease.
Right, and then the concept of pre-screening, it follows in line with a lot of things when we talk about cancer just in general, is cancer oftentimes goes asymptomatic for a while, and that if you wait to treat something once it becomes symptomatic, it may be unmanageable, right, as opposed to actually taking advantage of the screening at the timeframes that are being found by research to say this is a great time to do this, unless there's family history or other risk factors that are involved. That is going to help survivability.
Correct, exactly. So, people are going to ask me, what are some of the concerning symptoms or signs that you see? Any change in your bowel habits, any recent unexplained weight loss, blood in your stools, a change in your stool size, shape, or consistency would prompt an evaluation. And, I'm not here to talk about, the colonoscopy is the gold standard for detecting colon polyps, which, I described to people as little mushrooms that grow from the lining, that in some people, and again, not everybody, these polyps are usually benign, but some cases, these polyps can be adenomas or precancerous. And if you take them out, you basically negate that from progressing into a cancer. So not all polyps are bad, and not everyone with precancerous polyps develop colon cancer.
Right.
So besides a colonoscopy, there are other ways for being screened for colon cancer, and the one that's now being recommended is called the fecal immunochemical test, or the FIT test for stool. Now this is different than the usual stool test that was done before, which was a guaiac, in that it only detects human globulin or human blood, and it's specific for any bleeding from the lower GI tract. So you don't have to worry about changing your diet when you're on this getting this stool test done. It does not interfere with any of the medications that you're taking, because in the past the stool tests they had their high level of false positive, meaning that yes, you would have positive for blood, but there'd be no reason for it, and sometimes it would be due to diet. So people eating a lot of meats would have that. Taking an aspirin, taking other medications would interfere with that. But this FIT stool test is actually a good way of starting out your colon cancer screening. And if a FIT test is positive, it suggests bleeding from your intestinal tract, or at least your colon, that would prompt your physician to recommend that you undergo colonoscopy. Now, one of the main, messages I want to reach out to you all out there is, people worry about, the colonoscopy. It's invasive. They're all concerned about how they're going to prep. But I'll tell you, the key to having a good quality exam is to make sure that you talk to your gastroenterologist about what it entails to have a colonoscopy. I tell my patients that the worst part of this whole process is drinking the prep the evening before your colonoscopy. I don't care what your stool looks like. I need to see what your colon lining looks like. So the cleaner your colon is, the better quality exam I'm going to be able to give you. Because the ultimate goal of doing a colonoscopy is to look for these little polyps or mushrooms. And if your colon is full of stool, we're not going to see them. So we're going to be giving you a suboptimal exam. So the key is to really get a good quality prep. Now, there are many preps that have come out in the last 10 years that have reduced in volume. So traditional, people think of drinking a full gallon of fluid the night before. Now, I personally cannot chug a gallon of fluid even for a few hours, so I can't expect my patients to do the same. So the newer preps out there are half a gallon, and we split it over 2 days. So it's a half volume, but you split it over 2 days to increase the quality of cleaning and increase compliance. It's easier to drink a quarter gallon on the evening prior to your procedure, and then wake up early the next morning on the day of your procedure and drink the other quarter gallon. By splitting the dose, we're seeing better quality cleaning, especially in the right side of the colon where these little polyps can hide. And again, the goal is to get these polyps out. So cleaner colon, better quality, better results to you. So that's
right.
important.
Well, I'll tell you, I want to shake horribly the person who calls it Go Lightly. Whoever named it, that's its own little sarcastic little joke. But but it is. I went through my first one last December, which I was not looking forward to at all. And that is exactly as you explained it. The prep was actually the part that is the most difficult, from what I understand. However, changing the diet a little leading into it, going to a more all-white diet, and then the last day, going straight to the Go Lightly, and then moving on to the following morning, it really wasn't that bad. It wasn't anything like what was being explained to me by when my folks would have to go through it, because I don't think they were nowhere near as colicky as what they complained about, and everything seemed to go fairly smoothly. And the actual procedure itself, I didn't even know what had happened. I was pleasantly medicated, and by the time everything was said and done, the doc was able to take care of and do everything that they needed to do. And like you said, they can find stuff, and I'd like to think that I prepared myself to have a pristine colon for my test, and they actually did. They found a standard polyp, and they did find a tubular adenoma, and it was a decent size to a point where I will go back again this year to get it checked again. However, he said, listen, I'm glad you did it. Most people are afraid. Most men are afraid to go through such a test. And he said, they usually will postpone. And he said, you postpone this 2 or 3 years and we've got a problem. So
Well, good for you for doing that. And, you're a prime example of, being able to do it and have good outcomes. So.
Well, I'll tell you, it looks like we're coming right up to the first break. You're hanging out with Providence Holy Cross, the Health Hour here on KHTS AM 1220 with our guest, Dr. Rahul Chhablani. And we're really getting into colorectal cancer month. We just got finished talking about the colonoscopy, and we're going to go into what's next, and things that can be done if there are any positive findings. Where is the research taking us, and how can we squash a lot of the worries and such that we're going through? So I look forward to having you guys back in the next few minutes. You're listening to KHTS AM 1220, your hometown station.